I helped start Lanesville Heritage in 1976. It began as a celebration for the 200th anniversary of our country. Over the years, it has really grown. We estimate now somewhere in the neighborhood of 75,000 over 3 days. This last maybe 20 years, I've been active in the machinery field, demonstrations, thrashing, baling, corn shredding. That's the area that I really enjoy, and I grew up doing all these things. As a kid, I had experienced a lot of these things, so it just comes handy for me to work with that type of equipment. I've had my right knee replaced. I've had the right shoulder replaced with a reverse joint, and now the left shoulder with a reverse joint. I could lift my arm, my left arm here, about waist high, and then pain shot through my shoulder above my waist. It just really bothered me, and at night you just couldn't get a spot where it didn't hurt and wake you up and keep you awake. So I looked Dr. Abeln up for a shoulder replacement.
In addition to arthritis, he had a complete tear of his rotator cuff. So hence the condition rotator cuff arthropathy. When the condition is as advanced as his was, there really are not a lot of great options outside of surgery. And so some options could be cortisone injections or some physical therapy or other treatments, but essentially none of that's going to restore the range of motion of your shoulder because the bone spurs and things like that are just not going to go away with short of surgery. So we can try some things and be flexible, but I'm also going to be honest and say the most predictable chance of success for him was to have his shoulder replaced. In patients with a rotator cuff tear, they don't have that rotator cuff to balance. So what we've done is reverse it, and so that's become the name of the implant itself. So instead, now on the humerus, you have a socket, and on the shoulder blade side, the ball is placed. And that is a much more stable construct, so that in rotator cuff deficient shoulders, they now have the ability to still lift their arm, and most importantly, have a stable shoulder.
Having been at Floyd Memorial before, I knew what to expect, more or less, and the nurses and all the people were great.
He's doing great. He's been a great patient, and he's almost right after surgery noted immediate relief of his pain, and now through therapy afterwards he's restored a lot of the strength in his shoulder he had lost, and I've just been very happy with him, for him, because he's gotten a lot of his life back, and so that's the goal of this surgery.
I hope to be back in action at Lanesville Heritage again this year. Maybe I can be a little more active than I was last year, because I was hampered last year with that shoulder. Now I feel much better shape than I was. I would recommend Dr. Abeln and Floyd Memorial for a shoulder replacement for anyone that's considering such. They did a really good job taking care of me.